Hello, I am Bernardo Merizalde. I'm a physician. I am an associate clinical professor at the Department of Integrative Medicine at Thomas Jefferson University in Philadelphia. I'm also board certified in psychiatry and integrative medicine. I have been in practice now for about 40 years, and I have been doing about 30 years of those in psychiatry. And through the course of my career, I have integrated other modalities that are integrative and complementary to conventional medicines because I have found that conventional medicines have limitations. So they work well in the majority of times, but often there are side effects. Sometimes people cannot take sufficient dosages to be able to treat their symptoms. And very often they don't treat them completely. So along the way, in looking for different approaches, exploring different avenues, there is the realm of the psychedelics, which have become very popular recently, most of the time not through legal channels. However, there is a lot of research that has been done, and there we have probably about 50 or 60 years of research that is available, both formal and non-formal. But especially in the past, probably 15, 20 years, they have become very popular. You have probably seen different articles published in the New York Times, very popular books about psychedelics. And so I'm not going to talk about the history of the use of psychedelics in humankind from the native individuals that have been using them, the peoples from around the world that have used psychedelics for transforming their present state of being and experiencing transcendental states of mind and used in ceremonial purposes, and all the amount of psychedelics that have been used for recreational purposes that have caused harm in many individuals. And that has been my experience, that there are people that have used these substances without really direction, without concern for dosaging or circumstance or the process in itself, and have been harmed. Fortunately, there are organizations that have compiled a lot of this data and are fostering legal research that is fantastic. This is the Multidisciplinary Association for Psychedelic Studies, MAPS.org, where they have all the research that has been done, a lot of resources, both for harms reduction, to look at how psychedelics can be used without causing any problems or any significant issues, but also what application they have in the treatment of PTSD, in the treatment of pain, in the treatment of addiction, in the treatment of anxiety and depression. Many people come to me because they have used psychedelics in the past. And I have seen people that have taken one trip too many and have caused mental disturbances that has taken sometimes years to be able to come back to a more normal state of functioning. But I have seen other people that have used microdosing, for example, of psilocybin or LSD, that have shown significant promise. They have been feeling better from anxiety, depression, from ADHD, and have been able to function much better because of the use of these microdosages. I have been able to counsel them and advise them about when and how that may be better to use. Although, unfortunately, I don't have access to those particular compounds, particularly LSD, psilocybin, DMT. But there is ketamine as well, which is legal. It is a Schedule II drug that can be prescribed with medical license, and that has been used to be very effective in treatment-resistant depression, especially with suicidal ideation. And there are different forms of it. There is the intravenous form, that there are many clinics around the country that are using this methodology, and through infusions once a week, every 2 weeks, that there has been a significant improvement in these patients that have not responded to conventional antidepressants with good success. In my practice, I've been able to use sublingual, which is easier to administer. And it is quick in acting. It works within 15 minutes. It takes about 45 minutes for it to dissipate. And then the person can enter into this space of being able to explore different experiences and emotions and be able to integrate it at a different level and find relief from a lot of the depressive and anxiety symptoms that they have. It has to be done with supervision, with direction, but I have found it to be very effective, and people that have used it have found tremendous benefit from it. Then there are people that come to me because they have found psilocybin mushrooms through their contacts, and they come to me because they want to make sure that they are safe in doing them. And there are people that are willing to sit with them and help them through the process. Psilocybin, of course, lasts a lot longer. Usually, a trip with psilocybin can take up to 5 hours, can be 3 to 5 hours, depending on the dosage and depending on the person. And it tends to be much more expansive than the ketamine. Ketamine is a little bit more restricted in its dissociative capabilities, and it does not have as much as the sensory distortions that can occur with psilocybin. But that experience of transcendence can be very meaningful for people. Work done in Johns Hopkins University have shown that people, for example, that have significant depression and anxiety from cancer, in one single session sometimes has been transformative and has made these people find less fear and less suffering from the condition they're suffering from. So there's still a lot of research to be done in this field, of course, but it is going to be important to continue talking to legislators and to talk to people about how important this is, because I think that psychedelics could really bring a significant revolution. Some of the movements that are working also is on legitimizing the use and making them legal for treatment. And there are several cities in the United States where the use of mushrooms, for example, more for religious purposes, but usually is given within this context of support for the personal transformative experience. And we know, for example, Salt Lake City, Washington, D.C., and Portland, Oregon are cities where you can have some amount of psilocybin for personal use only, not for distribution, and otherwise, but on a federal standpoint, is still illegal. So I would not recommend people to go on that avenue for the time being. However, to be able to contact your local representatives to be able to move in that direction. One of the medications, for example, that is being worked on to pass legislation is MDMA, also called as ecstasy, which was very popular in the 1990s in the rave dance halls and was used for that purpose. And it is also very effective for the treatment of PTSD. Many times has been used in individual psychotherapy to be able to help with interpersonal conflict in couples, and has been very effective. And there is some research on that. So I want to put that little question in your mind about how effective these medications can be, how they can be the future of psychopharmacology in the treatment of patients, especially people that are not tolerating or don't respond to conventional medications, but also maybe in the early stages of treatment, that it could be groundbreaking for some individuals that are suffering tremendously. Thank you for your time.